Hello, I am Dr. Sauren Panja. I am Head and Senior Consultant of Critical Care Medicine Department in NH Tagore Hospital. Today I want to highlight some of the points about the COVID-19. As you all know, right now we are really afraid about the COVID-19. This is also called novel coronavirus. This is a particular strain of the coronavirus which normally causes upper respiratory tract infection like influenza. And if right now for about say since December almost more than 2 lakhs population worldwide that they have got affected with this COVID-19 infection, and today's figure there is more than 8,000 deaths, and in India more than 150 cases are there right now. And right now I want to discuss how this infection happens. Normally this is a special strain of the coronavirus, and we don't have any immunity about that virus. That is why there is a kind of situation what is happening, and WHO has declared it as one pandemic. More than 150 countries has got affected. This infection happens right now because from person to person. Earlier it started with some animal from animal kingdom to human life, and right now because of one infected patients, because of their coughing or sneezing, there is small droplet formation, and once we are inhaling that droplet, that is causing infection. Usually after inhaling the droplets, usually after 2 to 14 days after that, we normally actually clinically manifest as infection. So what are the symptoms of that infection? Usually there will be fever, cough, body ache or malaise, and gradually some of the patient may develop respiratory distress. And if you look at the symptomatology, usually after 7 to 10 days the respiratory distress may happen. Usually 85% patients they are mild category, and 10 to 15% cases there will be a severe kind of infection. Some particular patient more than 60 years of age with cardiovascular disease, diabetes, hypertension, coronary artery disease, or sometimes cancer, this type of patient they are basically a bad group of patients who are suffering mostly because of that infection with complications, and there is death rate that is quite high in this group. So we should take precaution for that. How can we prevent that infection I will discuss, as well as what are the treatment. About the treatment, there is no specific antiviral treatment as of now, but about the treatment what we advise, the symptomatic treatment, and those who are suffering from respiratory distress or the low oxygen level in the body or low blood pressure, multiple organ failure, this group of patients should get admitted in the critical care unit, where doctors like us normally treat those patients. And about the prevention, so how can we prevent that infection? So about the prevention, we must remember that because this infection happens because of the coughing with small droplet formation, we should maintain some distance from if there is any patient is coughing or sneezing, as well as we should at individual level, if you have cough or sneeze, please maintain your cough etiquette or respiratory etiquette by putting hanky or any tissue paper during coughing in around your mouth and nose, or sometimes you can also bend your elbow and cough like this. That actually prevents your infection to spread in the community or to other persons. This is one way of direct prevention, and there are indirect way of basically infection, that is through our hands. Because we have some patients are coughing, that droplet may come to the table, chair, or sometimes door handle. If we are touching that, our hands are dirty. So with that dirty hand, if we touch our face or the eyes, that can also carry infection. To prevent that, please wash your hands before touching in mouth and or eyes. So please keep your hands away from mouth, nose or throat, nose or eyes, because that can carry infection. So please basically that habit should be abandoned. And next one is about the use of the mask. Once we are using the mask, please don't use mask in general, because that will create a kind of panic situation, as well as that will unnecessary use of mask is not necessary. Because once you are putting a mask outside this, there are dirty droplets may be there, and you are touching with your hands, that your hands are getting dirty, and that can also carry infection. So it is better to avoid in general mask use, but those who are coughing or sneezing, they can use it to prevent spread in the of infection in the community. So that is another thing. And when we should go for the testing, actually you please consult with your doctor. If doctor feels that this is the suitable case for the testing for the COVID-19, then only it should be advised. As of now, because the India is in phase 2, each and every patient should not get tested for the COVID-19. We actually calculate the risk factor about the infection. If someone is having history of travel outside, or there is direct contact with COVID-19, or some health worker, those who are working, there is a contact with some patient or suspect, then only we can ask for the testing. So please don't think that without testing it will not be most of the time the testing is not necessary as of now. If it is necessary, the government will direct as well as doctors will advise. So I think with this you must be getting benefit of that, and if we practice the same thing, I hope that will help us to combat this COVID-19 as well as eradicate from COVID-19 in the near future. With this, I thanks, and I hope all of you will be healthy. Please, best of luck. With this, I thanks all of you.